Hi, my name is Michelle Dardeshi. I was diagnosed with breast cancer around 2 years ago and I took part in the Parable trial. To be honest, I felt fine, absolutely fine. I'd always checked my breast because you grow up with that sort of thing being advertised. I found a lump, I went to my GP, she checked it, she said, yeah, because you're concerned, it's an instant referral, within 2 weeks you'll be seen, and within 2 weeks I was. The nurses were brilliant where I went to. They checked, they did a thing, they said, we can see something, we're not sure exactly what it is yet, we need to do biopsies and stuff, so I had that immediately. They confirmed it was breast cancer and told me all about the type of cancer and everything, that they'd found out what it was. I've got to say they were absolutely amazing. From diagnosis of finding out I had breast cancer to my operation, I think was a month. And then again after that, I'd had my surgery, and a month after that, I started my chemo. I was really, really fortunate with the speed, the diagnosis, the treatment, everything I got. I honestly couldn't complain. After I'd had my chemotherapy and that had finished, I was coming towards the end and we were discussing my radiotherapy that would happen. They asked me if I'd be interested in a trial because they said I might hit the kind of criteria for this. And I said, okay, I'm open to it, whatever you think's best. I was kind of very open-minded about it, was happy to hear what they had to say. Then they gave me some information about it. So they said, we'll give you a booklet, you can read about it. And then I went back and they explained it to me in really, really simple terms. And I think that's what really helped me. So they explained that how one radiotherapy worked and how the other one would work, and the advantages of the kind of research or trial, whichever vocabulary you want to use for it, would be different. My trial was called the Parable trial. It's a type of radiotherapy, and I'll explain it how they explained it to me because it helped. The Parable trial meant that they could control the depth of the radiotherapy. So she said it's more like a bowling ball and pin, like you send it in, it hits where your target is, and that's it, it goes, it drops. So like where I've got your chest wall and stuff to go across, they could stop it having to go through my organs in the middle because they could just do it for the depths of the skin, the layer that they were treating. The trial unfortunately wasn't near where I live, so there was two choices, Manchester or London. I did live in London for 6 years, so I was like, right, that's my stomping ground, I feel more comfortable there. And they were really obliged and said, that's fine, you can go to London and do it, there's no problem. They were like, whichever you feel better with, so that's where I went. Had to go down and do like a trial day, like a pre-clinic assessment, so that was really helpful in terms of finding out like where the hospital was, all those practical things. But I took my husband and my child with me for my first appointment, with where I got to see everything and where everything was, so that I didn't feel like I was on my own finding where it was, and everyone was fine with this. There was no issue with them being there. Because it's called a trial, there's unknown there, and you don't know particularly what's gonna, the outcomes of it. But everything I was told about how they explained how it worked kind of gave me the impression that they knew kind of a fair amount about it. It wasn't brand new, it was a new thing that they'd obviously, to get to that point anyway, they had a lot of research around it and how it would work. I wasn't scared by it. I think the only way anything can ever move forwards. And at that point, I guess I just thought, well, go for it, see how it goes, and kind of, there's all the people that come after me as well in life, like how is it going to impact them? Is it going to be amazing for them? We need to make these advancements for the next generations, for the people coming after us. I'd say get all the information you think you need. For me, it was worth going through the practical elements, doing the changes to daily routine and all the rest of it. Ask the information, ask the questions. I asked many, I wrote them down, I had them in a list, I asked all the questions once I'd been given the information. Everything was explained to me in a really simple way. I said, if there was something I didn't understand, I asked. Like, don't be afraid, you're not going to look silly, no one's judging you. You need to make that choice and you need to have the information. You are looked after from start to finish. It's got to the point of a trial and stuff for a reason in my eyes. If you can do it, do it.